Okay, last thing, condense rooms to permit increased room count. That's why dentists say my room is too small and congested. I know some of you got rooms like this. There's stuff everywhere. Okay, all right. So we got stuff in drawers, and half of that stuff is stuff you're not going to use for months. Get it out of the room. You got stuff in those little jars. Get it at your fingertips. All right, half the stuff went out the door, half the stuff went to your fingertips. Now I got to figure out the rest of the stuff. The really expensive stuff, I want to be able to inventory that really well. So I got to find a place for it. Remember, we figured out the problem long before we figured out the solution. Here's the reason we messed up. Now, you could move the hand pieces near where everything else is. Doesn't matter. We'll talk about that later. Does not matter. Does not affect production one bit. You can put them anywhere you want. I don't care. There are guys in the 60s tried to hang them from the ceiling like Jiffy Lube. Works. Patients don't like it so much. You can do it. So now, since there's nothing in here anymore, we need some of that surface somewhere over there, because I know that I got to have something there. Computers got really small. You know, we had all this stuff to support computers that are tiny now. I don't want to have the schedule where the patient can see it. It's not relevant to them. It's relevant to me. And now if I do that, I got a ton of room to go ahead and mobilize. I can reach what I use. Whether you make the room smaller or not is a whole separate issue. What's relevant is the stuff that you need needs to be where you use it. And if you got it behind the dental assistant, that's insane. If you got it over on some side cabinet over here, that's insane. This evolved from when you had one treatment room in 1940 with a big cabinet with a bunch of little drawers, and you kind of spit on the instrument and cleaned it off and put it back in the drawer. That's where this came from. Once all the instruments left the room, the whole game changed. But we didn't change with it. We just kept the same plan as they had in 1940. It all changed as soon as the instruments left the room, and it didn't make us less efficient. When we went from a little glass jar in a room to that, it made us more efficient. And we didn't recognize or appreciate that. So that's the essence of that. Now, what's a room look like when you're done with that? Looks like that. So from a patient standpoint, and I don't think we're going to talk about the psychology of spaciousness today. I got about 60 hours of information. We're going to give you 3. But that's what a room looks like. That look okay with a patient? I want to end on, the patient came in, had seen 5 dentists over the past 6 months. Young woman making her own buying decision. Said, I don't know. Now this is her 3rd or 4th minute in the practice. I don't know. Been to 5 other dentists. You're going to be my dentist. This just feels right. What I wanted to say, because I'm a left-brainer, is you can't make a buying decision that way. You don't know about my crown margins. You don't know anything. What I need to say is thank you very much for being our patient.